We now continue our Insight event with a conversation about Humana, and this time Humana in Philadelphia, so on the eastern side of Pennsylvania. I'm your host here, Mike Asti, and for all of us here at Neishloss and Fleming and Integrity Marketing Group, we thank you for watching. We know this is a very important and impactful AEP, and it's important for you, the agent, to soak up all this information to best serve your clients. And for this conversation, we are going to be joined by Judy Gee, who is the Broker Relationship Manager with Humana. And you also may know her from her conversation and dealings with the western side of the state in western Pennsylvania, our backyard, but we also, of course, deal on the eastern side of Pennsylvania over there where the cheesesteaks are plentiful in Philadelphia. So Judy, I understand you have a slide deck for us. If you want to go ahead and share that, and we will cover the eastern side in Philadelphia with Humana.
Excellent. Thanks so much, Mike. And we truly appreciate being invited to be part of the family at Neishloss. And we're excited to share the information today about what Humana is doing for the balance of 2020 and into 2021. So what you see is your contact screen in front of us. Mike Bully is our state director for Pennsylvania and Southern New Jersey. Hadim and myself are the broker relationship manager and executive that support our agents in the field. And then we have local managers throughout the state, but Mike Simon is the Greater Philadelphia sales manager. Many agents working in that market are probably already familiar with him.
Right.
So first and foremost, we want to thank you. Humana could not do what it does out in the field without our relationships with our external agents. So we do thank you for everything that you do and for allowing us to help take care of your members. I'm going to go over our 2020 wins for our members and our agents. We'll touch on the September updates, go over the big news, the 2021 benefit reviews and the PDP plans. And then we'll touch on technologies and how we can help with that. And we do run technology trainings every Thursday to help agents get used to the tools. So with that being said, Humana was actually founded by two gentlemen who were looking for better nursing home care for their mothers. And their goal in creating the name Humana was it had human in it. And Humana is going to get back to its roots in 2021 and really talk about human care and how that helps take care of our. So we understand that it's caused a lot of stress and strain on our membership. So Humana waived all medical fees regarding COVID, whether it be the test, a doctor's appointment, or a hospital stay. Our members did not pay any bills for those. And we stretched that forward for the balance of 2020 by waiving all PCP costs, behavioral health visits, and telemedicine visits so that members could be seen where they wanted and felt safe being seen. We also took the time to show them that how much we cared. So for our members, we sent them all care kits if they were on an MAPD or MA only plan. They had Humana cloth face masks in it, hand sanitizers, a thank you letter, and a guide to staying healthy with COVID. We also sent masks to our agents that sold MAPD and MA only plans in 2020 in order to help protect them while they were out in their communities. So the next question is, what else is Humana doing for you, our agents? Mike knows how I feel about this one. We did a lot of changes for certification.
Absolutely. Yeah, this is important to Humana, and I can attest that Humana was out in the forefront of this even during quarantine and really even before. You guys have done a lot in terms of trying to help your agents with different marketing strategies, but this is a nice addition as well because it takes less stress away, takes some stress away from them. I know that the AHIP test was a stress for a lot of agents last year, so this is a big deal.
Absolutely. So in 2020, Humana only allowed 3 attempts at AHIP, and in 2021, we're expanding that to 6. We're making it an all-in-one certification. We used to have some PDP only, but agents sold products that they weren't certified for and ended up with allegations. So we made it easier and put it in an all-in-one certification so agents can sell whatever they want to across the board. And most importantly, we removed the carrier test at the end of our certification. So now agents need to review the modules, and when they get to the end, they just attest that they completed it. One less test, one less stressor. And then what we did, how do you win with Humana when it comes to your AHIP? If you do your AHIP through the Humana certification site, you'll get a $50 discount right out of the gate. And then if you enroll 10 MAPD or 40 PDP members, and they need to be accredited by CMS, Humana will reimburse you the balance of the $125 cost of your certification. And then we have Facebook going into a virtual world where we're not sure how long we'll be going in and out of this.
Right.
We've created a media social pilot for business Facebook pages. So if you do this module, and we have pre-approved pieces in our marketing resource center that you can pull out and post right to your business Facebook page, and it's all CMS approved and protected for you. Humana Reach Rewards. It is a program no other carrier is doing at the moment, and it is a way to thank the agents and reward the agents for the activities that they do every day. We used to have the Elite Agent program in place, but that only benefited 20% of the top selling agents with Humana. This program is going to this program is actually going to be great for every agent that works on all different levels with Humana. So how does it work? You start at a bronze level and you can earn all the way up to ambassador level. You can get points that equal money put into your MRC to help you with flyers, marketing material, and other items that are on there and available for you. How do you earn points? You can do it by doing sales activity or non-sales activities. As you can see, you can get 100 points for an MA, MAPD, or Med Sup sale, 75 for a plan change, 50 for PDP apps, and go all the way across to you get extra points for using electronic enrollment tools, attending Ignite webinars, even downloading materials. So a lot of different activities, the things that you do every single day, why not get rewarded for them?
Yeah, exactly. And that's the thing. You're not adding more work for the agent. It's just rewarding them for the work they already would be doing and kind of appreciating it more. And also that MRC tool, it's cannot go understated. It's a big deal, especially now because of COVID and having to have the advancements of technology be revved up even more. Some people forced to be handling social media marketing or technology they weren't familiar with in the past. And that's a place with Humana and what they're offering that if you want to be able to market on social media, but you don't necessarily understand social media or you haven't been prevalent on there to this point, you can use Humana's, it's right in the Vantage tool. You can use that tool. They'll give you different examples of posts and it can go right to your social media channels. So once they're in existence, you don't necessarily even have to learn what to do on those channels in particular. You can go from Humana to there and it's all going to be CMS regulated. They're not going to put anything in there that's not. So that's definitely a major thing that Humana is doing that I haven't seen elsewhere. So that's big marketing wise and make it easier for agents in this challenging climate.
Absolutely. And we're doing other things other than just CMRC. So as you move through bronze, silver, gold, platinum, ambassador,
Mm-hmm.
we'll do Kaplan professional coaches for you. We'll help you with
Wow.
your AHIP, do a recognition plaque, Google My Business. It doesn't stop at just CMRC. But where's the but? You have to sign up for it. If you go on humanareachrewards.com and click sign up, it's going to send you an email and ask you to create a password, create your profile, and then just start earning points for all of your activities. The problem is over the last 2 months, we've had agents hit silver level, but they never signed up. So we need you to sign up so that we can thank you and reward you.
That would be unfortunate too. You don't want to have that happen. No, you definitely want to make sure you sign up. It doesn't take long to do so. And then you have so much at your disposal that you get rewarded for. Absolutely.
Absolutely. So healthy food cards, such an amazing tool to help take care of people with food insecurities.
Mm-hmm.
In 2021, Humana is going to bring the food card in on our existing HMO D-SNP plan that's already in Pennsylvania. The importance of this screen that you see right now is Humana is going to take that benefit from 2021, that $25 food card, and we have already sent out cards to your members on that plan to use starting in September. This month, they will get food cards to use for the rest of this year. I love that we are reaching and trying to find different ways to support our members, and I'm proud of that the company took these steps. So as I just mentioned, that September updates, that food card is big. Even though it's on the 2021 benefit grid, they're getting it in 2020 right now. We've added voice signature to Enrollment Hub. We keep making that platform better. The first looks have been updated with the insulin savings program that we're doing. PDP information has now been released, and we'll go over that today. We have added standalone dental and vision plans. You can now enroll that members on Enrollment Hub right into those plans. And now on Reach Rewards, by attending local trainings and by using digital marketing material, you get rewarded for those two starting yesterday. So lots of changes. Another big change, 2021 renewal changes. Those of you that are familiar with Humana and have written for a while, you would know that when you wrote a plan in a year, whatever was in that renewal guarantee at that time is what you made on that plan with no changes moving forward. Starting in 2021 January, policies with an effective date after January 1st, 2020, they are going to update each year based on the fair market value. Those are rates that are set by CMS. Policies that were before that date will still apply to the locked-in rate, but anything from 2021 forward is going to get that fair market value increase. So we are working hard to make sure that those renewals are valuable to you. Humana Member Care Assessment. Taking care of your members is what you do every day, and Humana wants to do it with you. So the Member Care Assessment is kind of like other carriers' HRAs. However, a lot of our questions are based on food insecurities, knowing that you're safe where you sleep. It's going to be available starting 10/1, and you do have to do a mandatory training on Market Point University. Literally, it's a job aid, and it's an attestation, something that you can complete very quickly, very easily. You can do the survey on any MAPD or MA only application. It isn't just for dual eligibles. It is across all of our platform for MAPD and MA. The other important thing is you can use any platform to enroll. Some other carriers say you have to use the EPIs. With Humana, you can use your upline's EPI. You can use Humana enrollment tools. You can even do a paper application and then sign on to the survey tool and do the survey and earn $50 for every survey that you complete as an administrative fee. So, Mike, I am really excited about the opportunity to take better care of our members.
Yeah, absolutely. It definitely sounds like there's a lot of benefits and a lot of ways to appreciate them and reward them for just by doing their normal work here. And again, speaking with Judy Gee, the broker relationship manager with Humana, as we're covering the Philadelphia market here as part of our Insight event. And as we're continuing on, I'm sure we're also going to get into some of that nitty-gritty on benefits as well as some of these plans that are hitting the Philadelphia area.
Absolutely. That's going to be our next deep dive.
There you go.
Just touch on platforms really quick. Enrollment Hub now has digital scope and app where people can sign with their finger if they're face-to-face or with a mouse. We have eScope and an application where you can do email, scope, and signature on an app. And this week we added IVR signatures so that you can do a voice recording of the acceptance of the application at the end of the app. Fast App is still there, still has email and IVR, but it's truly built for our med subs as we get Enrollment Hub up and moving. Digital marketing material is the most compliant way to get formal presentation information into your beneficiaries' hands in a virtual world. We will actually attach links to the star rating, the summary of benefit, everything that you need for the formal setting. And lastly, the verification tool. It used to be that agents would call into Humana to verify someone's eligibility to go onto a dual eligible plan. We have now added that tool to Vantage, and agents now have access to the MARC system to go right on Vantage, put in their prospective members' information, and we will come back and tell them if they qualify without spending any time on the phone. So now we're getting into that what's new with Humana. Let's talk about a little bit more deep dive about the benefits.
Yeah.
So the first look documents are out there and updated with benchmarks. If you go on first looks at humana.com, click on 2021 plan benefits, click on your state, click on your region. It will show you the top plans available there for MAPD and MA. It will show you the PDP information and some Medicare supplement options in that area. Senior Savings Program and COPD VBID. You're going to hear those quite often. The Senior Savings Program is a program that allows members using insulin programs to get a discount on that insulin. It will improve their medication adherence, thereby giving them a healthier outcome. The COPD is unique to Humana, and it is a program that we are adding to our plans, but a member has to opt in to be involved in the plan. And it's a way of us helping track and coach our members with COPD, and it also allows them to get their inhalers at a discount, but they have to opt in. So those are two things that you'll hear as we go through our 2021 plans. Here are our heavyweights. I think that these are the most unique plans in the marketplace, and their strength just continues to impress me. So the first plan, which many of you are aware of, we have our 5216221 Honors Plan. This is our Veterans Plan. If you are a veteran, I thank you for your service. And if you are Vietnam era, I welcome you home. This plan has a $55 Part B give back. It has new transportation added to it, and we maintain the MSVs. So it's statewide minus 6 counties, and we are going to continue to work hard to help take care of our veterans. Our next plan is our existing DSNP HMO, Plan 6622-038. We have added 8 more counties onto that plan: Bradford, Carbon, Crawford, Franklin, Lebanon, Monroe, Schuylkill, and Tioga. We are bringing that $25 food card onto that plan. And as we talked about, it's coming in right now to the members already on it in September.
Yeah.
And we maintain those MSBs. New to Pennsylvania, we have Plan 5216227. This is a DSNP PPO, brand new in 27 counties in Pennsylvania. I know it's not in the Philly network, but if any agents are cross-selling or taking care of people in other parts of the state, it has a $50 food card and really strong MSBs.
And which can be done easily with different online enrollment platforms. We certainly offer one here at Nischloss called Medicare Center, Humana, and other carriers offering their own. So there are ways to be able to sell throughout your entire state, especially big ones like Pennsylvania, even if it's not in your backyard and you don't feel comfortable driving an hour like you normally would have done, or the client doesn't even want you to come to their kitchen table literally because of the pandemic. There are still ways to get that sale, and your license is not just for Philadelphia, it is for the entire state. So that's a plan definitely to still be aware of. You still could bring up, and there's still ways to get sales without actually even having to travel. Certainly right now, that might even be more popular.
Absolutely agree. Our last plan that we heard a lot about, most sold plan for 2020, was our 5525038. It is a 0 premium PPO that is across the state except for 4 counties. Agents loved it, but they said you have a $300 medical deductible on that, and we are not pleased with that. We heard you. In 2021, we are removing that medical deductible, reducing the PCP, and maintaining the MSBs. So those are the 4 unique make sure you have the information in your back pocket. They might come in handy. Busy screen, right? So in the top right, you'll see a map of the counties that it covers. It lists the counties underneath it, and this is for educational purposes for agents, not to be used with beneficiaries. But we heard the agent say, we want one sheet to look at to know what plans are available in that area, and this will be a quick at a glance for you.
Right.
Where you see white is where the plan's held stable and strong. Where you see green is where we made improvements. And where you see the peach color is where we tweak the benefit a little bit to give it a new, unique feel. You will see across the bottom of the screen, it has counties listed, so you know which counties each one of the plans is available in. There are a couple benefits that hold steady across all the plans, so I'm going to touch on those really quick. The skilled nursing facilities are going to be the same across all plans. The fitness is going to be the same across all plans. The after inpatient stay meal will be available 4 times a year, 10 meals sent to a beneficiary to help them recover from their stay. So those are commonalities amongst this. The first plan is H6622035. It's a 0 premium HMO, 0 medical deductible. You'll see we made the inpatient stronger at $250 a day, days 1 through 6. PCP is 0, specialist 35. We strengthen the RX string on tier 1 and 2. Please remember that every MAPD plan has Humana pharmacy option on there where they can get their tier 1 and tier 2 drugs, 90-day supply, 0 premium, delivered right to their home. The dental on this plan is $2,000 max with 2 cleanings. Vision is $300 with 0 exam. Hearing is unique to Humana. Instead of giving them a dollar amount and then the member not knowing what's actually going to come out of their pocket, Humana partnered with True Hearing, and we have co-pays on our hearing aids. So an advanced level hearing aid is $499 and premium is $799. This plan has an OTC benefit of $75 a quarter. And you will see that we have the insulin program on here and the COPD, and it is in Berks County. The second HMO that you see is 6622036. That's in Lehigh, Northampton, and Schuylkill. It's another 0 premium HMO, 0 on the medical deductible. $250 days 1 through 6 was an improvement. 0 PCP, and we lowered the specialist to 35. We strengthened that preferred RX string. And then you have 2,000 in dental, plus 2 cleanings, 100 in vision, plus 0 on the exam. The hearing is advanced $499 and premium $799. We've got a $45 a quarter OTC benefit on it. And this program also has insulin and the COPD opt-in. Plan 3 is 5525006. This is a passive LPPO plan.
Okay. I do see there's a premium with this plan in comparison to the other two. There's a little small premium here. Yeah.
Absolutely. So remember, when you hear PPO, it's a nationwide platform. Members can go to any Humana PPO doctor in the country and pay the same cost as though they were here in their own network. It is a $28. I'm sorry, I want to make sure that I explain passive. So passive means Humana is going to have the member experience the same cost in or out of network on this plan. It's a $28 premium, 0 medical deductible, $350 a day, days 1 through 5, $10 specialist, $10 PCP, $40 specialist. We held strong on the strings, 1,000 in dental, 100 in vision, $499 and $799 on the hearing. See the peach here. So members said during COVID, it's great that you give this to me, but it's a use it or lose it benefit if they didn't use it by the end of the quarter. So we heard them, and we may have reduced the benefit just a little bit to $30 a quarter, but we gave it a carryover option so that it can carry over quarter to quarter as long as they use it by the end of December.
Yeah, and that's nice. That's nice because then if you forget or if you have other stresses going on or you don't have to lose it, you don't have to worry about that. You're going to receive that benefit. I think that's definitely a nice little added touch. And it's really all about when you're discussing these plans, it's really all about serving the client's needs. If a client is somebody that travels across the country or has a Florida home or anything like that, then they're going to need to be able to travel with that network and have the network be as high quality as they would like. Whereas maybe if that's not the case, that wouldn't be in much necessarily of their concern here as we continue with these plans. And again, it certainly looks like Humana has a diverse portfolio, but something for everyone.
Absolutely. And that passive PPO is in Berks and Lehigh. Our next plan is one of those unique plans that I mentioned on the front, the 5525038, and this is Lehigh Valley market wide. It's a zero premium LPPO. We remove that medical deductible. Inpatient is $390 a day, days 1 through 5. Reduce that PCP to 0. Specialist at 40. We maintained our strings on the RX. For dental, it's 1,000 max with 2 cleanings. Vision is 100 with 0 copay on the exam. It's got the fitness benefit. Again, we added that carryover benefit on the OTC at $30 a quarter, and that one will continue to grow and stay strong within the marketplace. The next to last plan is the HMO D-SNP, the one that we talked about, that the members already on it got their food card this month. 6622038. You'll see dollar amounts here that are crossed out because that's the way that they appear in the summary of benefits. But as long as a member has Medicare and Medicaid, they are cost share protected and they cannot be balance billed. So that is dollar amounts that the Medicare and Medicaid take care of. So really the MSBs are what people focus on quite often. So the MSBs are 2,000 max with denture coverage and 2 cleanings. It has 2,000 in vision with 0 on the exam. The hearing aid on this plan is advanced level hearing aid. The copay to the member is 0. And they get 48 batteries to go with the hearing aid. They can get 1 per year, which means they get 2 per year at no cost.
Mm-hmm.
You'll see that we reduce the OTC benefit a little bit here to $200 a quarter. We have transportation on this plan, 61-way trips, 50 miles each way, and we added on that $25 food card, and that is market wide. The last plan is our honors plan. That is an MA only plan, and let me remind agents out there that you cannot write a separate PDP and have an MA plan. One will knock the other out. So this is truly built for someone that doesn't need the RX coverage. It has the $55 Part B give back. We added 1 day to the hospitalization, so it's $295 days 1 through 7, because we heard very clearly that agents wanted to see transportation on this plan. So we're kind of doing a balancing act here. It's a $20 PCP, $50 specialist, $250 in dental max coverage, including denture coverage and 2 cleanings, $100 on vision with 0 on the copay exam. Advanced level hearing aid, $699. Premier is $999. It has an OTC card of $150 a quarter, and we added on those 24 one-way trips, 50 miles each way. Before I leave the honors program, when you are speaking to a veteran, understand that they know what they know. If they say, I'm good, I use the VA for everything, that's amazing and you should support that. What we want to do is take care of them when they can't make it to the VA. If they're traveling the United States, you can't just go to another VA. So having some coverage so that you can go to a doctor or an emergency room and have that help take care of you, that's where we want to step in and make a difference.
And a lot of it does hinge on making sure you bring up the benefits and making sure you bring up these plans to the clients so you can know how to best serve them. And also, if you don't ask somebody if they're a veteran, you're not going to know. So it's first off asking somebody if they're a veteran or not. And if they do say yes, then of course, making just sure they're aware of everything at their disposal, because veterans may not be fully aware of all the benefits that they could be receiving or the ability to be able to be taken care of outside their home base there with the VA. And sometimes you could, cut away some of those complications that sometimes do arise for veterans as well, in terms of having to deal with so much. I mean, so much paperwork and so much involved sometimes in getting care for the veteran community, that this certainly could help them. Now, Judy here, and again, speaking with Judy Gee, the broker relationship manager with the Philadelphia region, as well as also Pittsburgh, but really the all of Pennsylvania here with Humana. Out of these plans, what are you expecting to experience the highest level of growth moving forward, as we continue throughout the year and onward into 2021?
So in the Lehigh Valley, I believe the 038, that where we remove that medical deductible, is going to be very, very strong going into 2021.
Mm-hmm.
Of course, if they're dual eligible, if they're a veteran, those are all going to vary. And Humana runs veterans trainings nonstop. It's important for you to have a baseline knowledge of what priority 1 to priority 8 means, if they're only going to the VA, or if they have TRICARE for Life, or CHAMPS VA. If you want to gain more knowledge, we pride ourselves on the fact that we run trainings all the time to help agents. So let's talk about network really quick. Humana has a good, solid network up in Lehigh. You'll see that we have all the Lehigh Valley hospitals. We have the St. Luke's, Sacred Heart, Penn State. I hear quite often people ask, Tower Reading was a new ad last year, and we didn't have all the doctors loaded in time for AEP, so it was kind of touch and go coming out of the gate. But they are in, fully loaded, and ready to go now. So our network in Lehigh is very, very strong. So here's your next busy slide. And because we've already talked about the honors plan, which is the last one, and these all 4 of these plans are market wide in all 5 counties.
Right.
We've already talked about the HMO DSNP. We need to touch on the 2 specific Greater Philly plans. So our first plan is the HMO plan, and it does look like it cut off my plan number. So I will make sure that I get you plan numbers for this.
No problem. Yeah, we can certainly
plan,
get that to them later. And there's going to be a lot of material that we can present to all these agents that they're going to get from the broker relationship managers, as well as us here at Nice Lawson Fleming. But I think having a synopsis like this for this event also is helpful, kind of a Spark Notes version that they can soak up as much knowledge on their own without having to dive in. But we'll make sure they get all that information.
Perfect. So the HMO Philadelphia plan is a 0 premium. It has 0 medical deductible, and we did increase the max out of pocket just a little bit. But as you can see the green going down, you know where we reinvested those dollars. Mm-hmm. So PCP is 0, specialist is 35. We strengthened the preferred RX string. We strengthened the dental benefit to 2,000 max with 2 cleanings. Vision is 200 with 0 copay on the exam. Hearing is $499 and $799. It has a $50 a quarter OTC benefit. We added transportation onto this plan, 18 one-way trips, 25 miles each way. And we added the insulin and the COPD option plan on here. So that HMO, even though we tweaked the MOOP a little bit, really you can see where we reinvested into the plan. The next plan is what I think will be the strongest plan in the Philadelphia area, Mike. So that's a passive LPPO.
Okay.
Same cost in and out of network to the members. 0 premium, 0 medical deductible. We got the PCP down to $5 and the specialist at $40. We maintain the strings. Dentals at 1,000 max with 2 cleanings, 100 vision with 0 on the exam. The hearing benefit on this plan, for an advanced level hearing aid, it's only $199, and the premium is $499. The OTC is $15 a month, and we tweaked it so it has a carryover benefit through the rest of the year. And it has the 12 one-way trips at 50 miles, and we added that COPD onto that plan. So these are the 4 major plans. The next one is the DSNP, which we just went over in Lehigh, and the Honors plan that we also went over in Lehigh. So these are the 4 major players for us in the Philadelphia market.
Mm-hmm.
So network is always a conversation in Philadelphia. We have 2 pages here. Grandview Hospital is new. So they did accept our PFFS, but now they're, as of 10/1/2020, they're accepting our HMO and our PPO.
Okay.
I hear a lot of people ask about St. Luke's and St. Mary's. They are both in network. The one unique group here is Chester County Hospital. Chester County Hospital will not accept Humana's HMO or PPO, but they will accept our PFFS plan. And that wasn't on our grid because it's not a top-selling plan as far as the whole market goes. But if you have a member going to Chester County Hospital, our PFFS plan had a $70 premium in 2020. It will be under $10 in 2021. So we can help take care of your members going to Chester. You'll see Mainline, Mercy, Phoenixville. I'm going to flip to the next page because that's more groups. We've got Einstein, Abington, Holy Redeemer, more main lines, more areas. We understand that Temple and UPenn do not bill us out of network. There are a couple different scenarios. We have a ton of groups around there, right within a mile of those locations that we do cover. And if a worst case scenario were to come to a member, if they paid that invoice when they went to Temple or UPenn and then sent that paid invoice to Humana with an out-of-network form, we are going to reimburse them short their copay. So even in worst case scenario, we aren't going to leave them hanging. So there's our main players as far as that market goes.
Right.
We really encourage agents to use the electronic platforms available to them. Our dual eligible plans now have their own application. You only really need to know that if you're still doing paper. But there are ways for us to help you and get you comfortable with the electronic platforms, or even one Nyschloff's platform, to do these enrollments so that you don't get caught up in the paper exchange.
Yeah, and I think that's the thing. We talked about that earlier in this presentation, that there are ways to ease in to technology, and whether that be marketing through the MRC tool or whether that just be through applications and using e-apps and things like that, different enrollment platforms for Humana or ours or anyone's out there, rather than have to dwell in the land of paper. But if that's where you want to be, Humana certainly is not going to leave you high and dry. You certainly can still get those sales and still can be able to access those apps and operate your business paper-wise. But I think the best practice probably is to try to ease into technology, because Humana is offering so many tools to get you there as easy as possible. As I said, again, the MRC, where you're just clicking something and picking something. You don't need to learn everything there is to know about social media, etc. So that's probably the best strategy, but these options do exist otherwise.
Yes, absolutely. So now let's talk about the PDP plans. Just came out this week for Humana. So I always like to have honesty right out of the gate because it helps you prepare. So our plan over here, the Humana Walmart Value Plan, it did go up a couple dollars. The premium is going to be $17.20. Last year, you could only use that plan at Walmart, at Sam's Club, and Humana Pharmacy. We have added to the list of preferred pharmacies for 2021, and they are listed down here. So we have Walmart Neighborhood Market, Sam's Club, which you don't need a membership to use their pharmacy, Publix, Kroger, Harris Teeter, H-E-B, Costco, and Prescribe It are all preferred pharmacies now on all three of these plans. The middle plan, which is the Humana Premier plan, it is our high-cost plan with the biggest formulary that we have, is $67.30. You can see that we have added the insulin program to this plan, which means the member's only going to pay $35 for the preferred insulin. And even going through the gap, it is going to stay at the dollar amount, not a percentage. So we believe that that is a strong move here on this middle plan. The last plan would be our Humana Basic plan. That is an LIS PDP. It was our least sold plan in 2020. Agents did not use this to enroll members because most of them identified if the member was LIS, they could get a reduced cost on an MAPD. With that being said, this plan is going to be non-commissionable in 2021. Medical cost ratios are off a little bit and we want to level those out. It will be there for members that choose to sign up onto the low-income subsidy PDP, but it will not be commissionable in 2021. Don't forget to be compliant in a virtual world. It's so easy to get lost.
Right.
Humana is going to give you all the tools to stay compliant through the digital marketing and the enrollment tools. We ask you, please stay compliant and please come to us if you need any additional help. So a quick digital marketing update. There are a lot of virtual educational seminars going on out there. If you're having one, please report it to Humana. We have pre-approved pieces on MRC to help you promote. You can select from multiple platforms of WebEx, Skype, Zoom, Facebook. Practice beforehand. It's so important that we're used to sitting across the table from people and building that relationship. In a virtual world, you have to feel that comfortable talking to a computer and allow how much you care to come through. And of course, ask your attendees to mute their lines. In a virtual world, people are mowing lawns, dogs are barking, things are going wrong. Try to control the noise around you.
Yeah, and that's easier said than done. Just in general, of course, things can go awry when you're meeting with someone in person as well, in terms of noise and in trying to stay focused. But it is important to be able to realize that there are ways to be able to still have the communication face to face without meeting them in person. So if they aren't comfortable or you aren't comfortable in meeting face to face, just calling people on the phone may not work as well in terms of them feeling a comfort to you, because by doing Zoom or Skype or Facebook Live or any of those platforms, even a FaceTime on your phone, if you both have a particular type of brand phone, you are able then to convey that emotion and they won't think you're misleading them because they can see your face. So using those tools, I think, is also a big deal. And obviously these are challenges that exist and are more necessary to be getting used to this year than ever before. They may exist as challenges for some, but this is the way of the future anyway, and would have probably been here at some point anyway.
Yeah, I think it just fast forwarded us
I
a
think it
little bit
just sped it up.
quicker than we thought.
Just sped it up. That's right. Yeah.
So let's touch on the enrollment tools really quick. Ease, accuracy, transparency. Your applications get, if you're using electronic platforms, those applications go right through the system. There's no misreading of a handwriting or a re-entry problem. So please take the time to get comfortable with these. Reach out to us, reach out to Nishlof. We'll help you get comfortable.
Mm-hmm.
There's no need to be uncomfortable. Once or twice, if you do a run through, you will find the comfort level.
Right.
Our RX tool is integrated with Blue Button 2.0. So if your consumer has an account where they've already put in all their medications, they can give you permission and you can get a pre-populated RX list. Our RX calculator is set to work with that, and it does run Humana pharmacy numbers to allow you to know if you can help them save money there. Find a doctor with care highlights. Humana has invested into Physician Finder. We now have it so that medical, dental, vision, and pharmacies are listed right across the top. It makes it easier to find things. We also introduced care highlights, which means we are now ranking the doctors based on the experience that the members have on clinical quality and cost efficiency. So if you pull up a doctor, if their clinical quality is off the charts, they're going to have 5 hearts. If they are the most cost effective, they're going to have 5 medals. There may be a shift in paradigm this year with people not actually going out and going to doctors. It might be more based on how the plan is going to treat them. So take the time after you ask if someone has a PCP, ask them more about that, because my husband has a PCP, but he's had that same PCP for 15 years.
Right.
If you ask me if I have a PCP, I'm going to say yes. And if you don't ask me anymore, then you're just going to assume my doctor. But I only see a doctor once a year for a physical. I don't have a relationship. And if the plan is right for me, I am more than happy to look at Physician Finder and find another doctor close by that meets that quality, clinical quality, and cost effectiveness. Not going to go deep into this. This is just to let you know that Humana does have a voice scope of appointment. There are 11 steps to it where you can call in and you can actually do a voice scope, and at the end write down the confirmation number, and Humana will keep it on file for you. Enrollment Hub, we've already talked about this tool. We do tech trainings all the time. You can use this for digital in-person, email, or voice signatures. And the neat thing is over here, you can see the screen. If you've completed a section, it will be in green. If it still needs some information, it's in yellow. And if you haven't done it yet, it's in gray. As you move through the application, everything turns over to green. And if you miss anything, it'll push you back to fix it. Digital marketing is the tool that I said is your most compliant delivery method. You can put in after you've gotten permission to email and you have a scope, you can go into digital marketing, put in their name, their email address, and their zip. It's going to show you all plans available in their area. You can pick the plans that you want to send them, and Humana is going to attach all the links so that they have all the required material for that formal presentation. Closing the sale is just the beginning. In a virtual world, you need to have a game plan on how you're going to retain these members. Humana has a 3, 30, 60, 90-day guide that gives you ideas. 3 days in, you call, make sure that they're comfortable. 30 days, you make sure that they got their kit, welcome kit in their card. 60 days that they enrolled in Go 365, that they're doing their well visits. And 90 days in, you cement the relationship. And that's very, very important when AEP ends, because then OEP begins. And January through March is a 90-day print that you need to retain your members during that, and you need to stay in touch with them. This guide will help you retain your members. So what's your next step? Help make healthcare more human. In a virtual world, we need our members to feel that they are well taken care of and that we are there for them. And with that being said, I want to thank Nijloff and Fleming. I want to thank our agents for being so involved with us. We want you to stay safe and be well, and know that Humana is here if there is anything that you need.
Absolutely. And again, thank you to Judy there, Judy Gee, the broker relationship manager with Humana, as we just covered Humana in the Philadelphia area. So Judy, we definitely appreciate the time, and I'll just kind of get us out of here with this. We talked about the growth of plans, the marketing tools, and kind of the advancements because of COVID and the climate we're in, and everything Humana is doing for the veteran community especially. But any advice you would give to agents out there on possible challenges they may encounter? Because there's going to be people that are going to bring something up and they're going to find something to pick at. I know sometimes network maybe is part of that. We did touch on that a little bit earlier, but any other challenges that maybe you would think could exist and advice to try to overcome those for agents?
I think in a virtual world, agents become frustrated sometimes with network if they don't know.
Right.
I would ask you to reach out to us. Just because a group might be out of network doesn't mean they aren't willing to bill us out of network. So
That's
I really
important.
think communication
Right.
is so important. And we have sales managers on the ground, and you have Hadim and I as your backup. You have your partner that knows these things. So I think just feeling comfortable reaching out and letting us help.
Yeah, I think that's important too. It's better to ask the question than to not know or to give the wrong answer. There's no stupid question out there, certainly. And even in the western side of Pennsylvania, the network sometimes could be a challenge. But if you ask, you still can maybe get over that hurdle because they're still willing to bill. So it doesn't make it that much of a difference for you necessarily. Judy Gee, the broker relationship manager with Humana in Pennsylvania. That conversation was about the Philadelphia area here. For all of us at Neishloss and Fleming and Integrity Marketing Group, I want to thank you for watching, and thanks to Judy for the conversation about what Humana is doing here in AP and beyond here in 2020 and then 2021 as well.